10:01, so we're running about a minute behind. We are recording today's Caregiver Community Statewide webinar and meeting. Today's discussion is largely around anticipating the end of ARPA flexibility and ARPA dollars. So please feel free to unmute as you have questions, feedback, ideas. I think that's probably one of the primary focus of today's meeting is to share ideas. You're also welcome to put information in the chat. And I did already put in the chat earlier the link to where our recordings can be found along with notes and supporting documentation. Just in keeping with, I guess, tradition, I will quickly share my screen so you can see what our agenda is for today. You all have an idea of where we're headed and what we hope to achieve. And then following that, then Janet, if she has any information, we always carve out time for advocacy and public policy updates. Then Lynn and I will share any updates we have. And from there, we will, hang on, I'm not sharing. Thank you for your patience. Following those updates, I put down some information that I could think of off the top of my head, which I'm sure are probably many of the resources that you guys are very familiar with as far as no cost and low cost supports. I think they're going to become increasingly critical, not just for folks who might be potentially put on a wait list because of the funding reducing, but also those folks who may not be eligible for our caregiver support programs. We certainly still want to offer them some type of support that can meet their needs. They're coming to us for some reason. So we'll explore these a little bit. And then the more robust part of the conversation, and we may even get to it before 10:30, is going to be what ideas do you have? How do you plan to restructure? Do you not plan to change anything? Do you have waitlist policies that you'd be willing to share? I have some more information related to that and what our GWAR nutrition team is doing. And we will conclude at the 11 o'clock hour, hopefully with a lot of really good insight resources. And those notes, again, will be posted on the GWAR website. And that link is in the chat. So I am going to stop sharing now that we have an aim for the goal of the day. And I'm sorry, I don't see Janet. There's about 56 people here. So if you're here, oh, there you are. Wonderful. If you have updates to share, please do so. And then we'll move on to Lynn.
Good morning. Yes, I am back now. I got kicked off, so hopefully I'll stay on this time. Just real quickly, our federal legislators are all in district right now for the month of August and will be until after Labor Day. So just a reminder that this is a really good time to reach out to your U.S. representative and our 2 U.S. senators to keep them up to date about how your caregiver support programs are going. What are the needs? How are these programs valued as we head into a time where they're going to be coming up with their final budget for fiscal year 2024. Right now, things don't look very good. Those budgets are level funded. And if we're going to get any additional funding, it's really going to take a lot of people to contact their legislators to hear just what are the needs in your communities and the needs of those people that you serve. At the state level, while there's a little bit of activity still going on, state legislators don't do a whole lot in the month of August, but we'll be starting up again this fall with a vengeance. And we're really going to be working very, very hard on some caregiver support programs, in particular the CARE Act. Many of you know that we've been working on this with a special group of folks we've been working with on a grant. We are now developing some relationships with some partners who've also been doing some work in the CARE Act. And I hope that this fall we will see legislation introduced. If we have any chance of getting it passed yet this session, I'm told we have to get it introduced this fall. So stay tuned and watch for opportunities to share stories, to connect with your legislators and share, how this piece of legislation would impact caregivers in your community who are caring for somebody who's been discharged from the hospital, and making sure that they've been involved in that discharge planning and have been trained to provide whatever care they're going to be responsible for when their loved one gets home. So that's it from me today, Bryn.
Wonderful. Thank you. Lynn, would you like to go?
Sure. I've just got a couple things. I did send out last week a notice that we've got the final version of the policy, the new operations manual. The family caregiver section has been finalized and approved and posted. So when we're thinking about our discussion today too, you notice that, the waivers that we had that started during COVID about no limits on supplemental funding, allowing family members to be paid, those sorts of things, those are now permanent. They're going to be permanent in our policy. The waiver was to the end of this year, but we decided those are things the state can control, and we decided to just leave those in there for the future. So that's good news. So you can think about that when you're thinking about this question about the end of ARPA funding. The other thing that we can think about too is I want to let you know that the lifespan respite program that Bader's now taken on, we were just notified not too long ago that they're offering us some supplemental funding for this current year. It's a one-time supplemental funding, kind of for administration, but also for us to expand with our CAW with the work that they've already been doing in their current work plan for the 5-year grant we have with them. And so there will be a little additional money available that our CAW will be putting into those grants that are available to family caregivers. So when, the counties and tribes, if you run out of money or our programs have limits and a family still needs something above and beyond what we can offer, those RCAW grants will have a little bit of extra funding through this supplemental money. We just submitted it, our application, and we're assuming we'll get at least some of it, if not the total amount we requested. So I'll keep you posted on when we actually get that approved, but we did apply for it, and hopefully we'll hear something in the near future.
Thank you. That is actually really wonderful news on both ends. So thank you. I appreciate that. And it comes at a time when I think we can all agree that any additional support that we can get, whether it's flexibility within the programs, caregiver stipend payment, or kind of the waiving of a cap, as well as those additional or supplemental respite dollars, even if it's one time, are certainly helpful. I did want to mention one thing real quick. It came into my mind as Janet was talking. Terry in Brown County has done an excellent job, and others of you have as well. Collected family caregiver stories. Most of them are very positive as it relates to what even a small grant has offered to them and their family. Some are on the flip side of that, sharing if they have not been able to access for whatever reason. Funds aren't available, they're on a wait list. They don't meet criteria or eligibility. Those stories are helpful. Please share them with your local legislator, with your local officials, representatives, and also you're welcome to send those to Janet, Lynn, and I. We do keep them. I have a whole folder, and especially as we talk about kind of raising our voices and sharing the importance of what it means to support family caregivers, those are helpful, especially when you have, a whole stack of folder to share with folks or to include in an email. That can be pretty powerful. Before we move on, are there questions, comments, feedback? Okay. I'm going to share my screen once again, just to go through the next portion of the agenda, because I inserted the actual links right into the agenda. I know that many of you are familiar with these. Some of you may not be super familiar. Either you just, you haven't had the time maybe to dabble or really utilize Trualta, or maybe you're newer to your role and these resources are actually new to you. So kind of level that playing field and at least have us all be thinking about ways to best use what is already existing and possibly how to build on them, I thought it would be worthwhile to just review some of these. Again, they're hyperlinked. I don't think I'm going to go into each of them today, but it's hopefully a place for you to come back to if you're wondering, oh, I know I heard that at the state meeting and I forget what it was, but I can go back to the notes. It's my hope that it's at least in one place for you. I've also included these links in the welcome letter that's provided to caregiver coordinator program staff or aging unit supervisors and directors. My advice is to bookmark this information. Trualta works best in Google Chrome. We've actually had issues if you open it in Internet Explorer. So if you bookmark it in Google Chrome. But there is a wealth of information in there for yourself to, take walking away material with. You can incorporate it into caregiver support programs. And of course, through the generous support of DHS, we are able to offer that free to family caregivers. Also on our Wisconsin Family and Caregiver Support site, we have virtual and telephonic support groups. Our support groups are changing now that we're kind of out and about and coming together more, and in-person offerings are much more available. So I have noticed people asking me to take off the virtual support groups, which is fine. If, however, there's opportunities for hybrid or you're aware of a different county offering those virtual supports, it's always nice if we take one thing off to possibly replace it with something else. So I'm open to that as well if you send me those updates. The other thing that's not often highlighted, but is very much a part of that same page on the Wisconsin Family and Caregiver.org site, is the telephonic support. There's quite a bit through WellMed, through the Alzheimer's Association, as well as United Way. There's also quite a few different podcasts. I know family caregivers are busy, sometimes they're multitasking, and information that can be delivered while maybe they're making a meal or they're driving to a place or they're getting ready in the morning, that can be easier to listen to take in than trying to weed their way through a bunch of pamphlets or brochures or flyers. So just keep those different methods of sharing information available and on the forefront of your mind. I did also highlight the resources tab of our wisconsincaregiver.org site. And one that I often have found helpful is the benefit checkup. So based on your zip code and then answering a few information about your situation, maybe you're interested in housing, maybe you're trying to learn if you have the accurate Medicare Part D plan, maybe you're a grandparent unexpectedly becoming a relative caregiver again, and trying to find out what's available. This benefits checkup is a great resource to find out what you might be eligible for, really just, again, to maximize family caregivers' experience and getting them all the resources that they're eligible for. I did not put the RCAW grants in here. That was an oversight. I should have included the links, but I did talk about, excuse me, their registry. I've noticed slow but positive growth when people begin to talk to other family caregivers or others in the community about the registry. I know that also some counties have taken the grants and really capitalized on that, doing a lot of marketing campaigns, radios, doing events, trying to pull together people interested in professional caregiving and trying to match them up with employers. So that's amazing. If that's a bit beyond your capacity in your day-to-day work, it is valuable to share what the registry is first to see if there's a respite care provider available. But then secondly, if there's folks who are interested in getting the free training and offering their help, maybe you have a daughter-in-law who assists with, coming in to provide you respite as a family caregiver when you need time away from your husband who has a diagnosis of Alzheimer's. Maybe she is looking to supplement that. Maybe she can offer to additional families. So if those are cases that you're coming across, I would definitely recommend the registry. And I did not put them on here, but most of our family caregivers, if they don't qualify, if they're put on a wait list, or if they've exhausted the local funds, are eligible for 2 grants. And I think actually this site I am going to try to open, so hopefully you'll follow along with me. Because I think maybe it was my own naivete, but I was not aware that, again, if the caregiver is not available, I'm sorry, not eligible for a program, if there aren't funds available, or if they've exhausted their resources within AFCSP or NFCSP, there are actually 2 grants they can apply for. One is the Caregiver Respite Grant Program, and then the other is a small amount, but it's a supplemental respite grant program. I think it's $250 if I remember correctly. And this is just a little bit of relief to help hire a person to help with housekeeping, meal prep, laundry, lawn care, snow removal, transportation, and technology. So please keep these in mind. Our respite care provider partners really do fill in the gaps when our grant programs can't meet everybody's needs. Let me go back to the agenda. And then consider other programs. As I've been as I've been engaged with the employer engagement work group, more and more I'm learning about areas that employers maybe already offer things, or we're encouraging them as a work group to offer things. So those would be the same resources in your capacity as a caregiver coordinator that you would want to explore the family caregiver to do research on. Maybe their employer already offers an employee assistance program. They might have, through that employee assistance program or EAP, a number of sessions for family counseling or individual counseling, free referrals or consults with legal aid or attorneys for a variety of different needs. They may have access to gym memberships or discounts to different types of wellness programs. Something I hadn't heard of until recently is ERG, or Employee Resource Group. These typically are peer-supported groups within a workforce that are led by a leader or co-leader who, again, is also a colleague or employee of this workplace. And they are able to facilitate that peer support through bringing in specialists to share information, possibly creating a culture that is far more family caregiving friendly than it had been in the past. And that could look like offering volunteer services or meal trains when somebody is in a situation they didn't expect to be in, and all of a sudden are a caregiver overnight. Of course, our DCSs, dementia care specialists, there's been a lot of conversation about really making sure if somebody is eligible or possibly eligible for long-term care, IRIS, or family care, that we encourage them to consider options in enrollment counseling. So it's not a force, it's not a must-have, it's just evaluating all of the different things that they might have to be eligible for and making sure we're connecting them to the right place. Veterans programs are huge. I was able to do a presentation with them, and there's a lot of VA benefits, transportation, caregiver payments, different types of adaptive aids, home modifications that are available through that program. And if they aren't aware, or the family caregiver isn't aware that those exist, we would want to encourage them or even connect ourselves with those programs so that we could possibly still supplement and offer supports. But if they're eligible for additional things, let's make sure they're getting access to those. And then lastly, the reason that we had Angie and Nick on last month to talk about health promotions and transportation is I think we're all going to have to become really savvy on how to access Older Americans Act grant programs. What I mean by that is if we've exhausted all of our Title III or National Family Caregiver dollars, And somebody 60 or older might be eligible for supplemental services through Title IIIB. That might be something we have to explore. Or if a caregiver would be eligible through the nutrition program for home delivered meals, we certainly would want nutrition program to be providing that and not necessarily having those funds come out of our Title IIIE dollars. So again, a lot of talking and maybe a lot of repetition for some of you on all of these low cost or no cost services, but I just want you to keep them in mind. And we can certainly add to this, especially as we move forward and we are all trying to do the best we can, possibly with quite a lot less. So with that, I will wrap up my talking and move into the entire group discussion. I know there were a couple of you in particular who had asked for this meeting simply because you're really trying to be proactive and anticipate what the needs might be. So if we could start there, what are some of the questions? What are some of the questions you'd ask of your colleagues as far as when wait lists will be implemented? How are people determining when individuals can come off that wait list? Are there counties who have instituted caps on funding for caregivers to really stretch those dollars? So I will be quiet and turn it over to the group.
So this is Terry. Thanks for giving us this opportunity to kind of kick these situations around. I'm a little nervous about next year. I'm just going to be honest, because in the past, now I've been managing the AFCSP, NFCSP since inception. In the past, we've gotten like $12,000 in NFCSP funding. The last 2 years, we've had in excess of 100,000. I am really curious as to how we're going to, and I know that some of it can carry over. I know all that, but it's still going to be a drastic cut from what we have had to what we're going to have. So I guess I'm just curious, and some of the ways that we've talked about or kicked around is that if you received NFCSP funds this year, then next year you can't get it. Do you know what I'm saying? You can get it the following year. I don't know. So we're just curious as to what is everybody else planning on doing? Because in the past, anybody that received funds this year, come January 1st, they come back through our doors and we just reevaluate where their needs are, make sure we have a good care plan in place for them, and we award them funds. And we've been fortunate enough to do that the last couple of years. But next year, I don't know that we're going to be able to do that because we're doing like 100 families in this program. We won't have that flexibility. So we're only giving them $1,000. It's not enough to scratch the surface for most of the families that we work with. I don't want to see it go less than $1,000. I don't want to see us award only 500 because to me, I don't know. I just, yeah, I'm open to suggestions. And I will share our waitlist policy.
Thank you for that. I think what I will do is take identifying information off, unless you would like it to be kept on, as far as different waitlist policies or different policies on caps for funding, and create a place on our technical assistance page for the family caregiver support. So folks can easily go there and at least have a starting place if that's something they're considering. So that's one thing I can offer. The other thing that I would offer is I've been a part of something called the meal prioritization work group. I've been listening to their recordings. Pam from our nutrition team has been amazing and included actually myself and Nick along the way, because we also recognize with the reduction of volunteers through the volunteer driver program, we may also have wait lists on that end of things. So a couple of things that I can offer for consideration are our current caregiver needs assessment, assigning points to that similar to how there is a meal prioritization, assigning points to those in greatest need or those in kind of lower or moderate need and those in lowest need. So that would probably be not quite a bit of work. It's very doable. We have the assessment. It's already broken down into sections and portions. It would really just be folks within the network here who have an interest and a desire in helping to assign points and evaluate points to that, so that we're all using it consistently. And that might offer, if we have somebody in greatest need, maybe they're at 1,000. If we have somebody in moderate, maybe that's a 500, and so on. So it doesn't have to look like that. It's just an idea. The other thing that I can offer on more of an advocacy level of things is that also within the nutrition team, they are collecting information. I'm sorry, what they're doing right now is that they have a sample letter, and I can certainly adapt that for our family caregiver program. And they are collecting names of folks on wait lists if they already have them. In some counties, they do. Or for those counties who may have to implement wait lists, they are sharing that template letter as an opportunity for folks to share why being put on a wait list has been harmful for them, what negative outcomes they've experienced, those types of things. It's very similar to collecting the very positive, wonderful stories about what even, $500 a year has offered a family. It would be a little bit of the reverse, sadly, and not proactive, but it's still a collection of personal stories that could have a meaningful impact. I did see something pop up in the chat. Terry, do you use Title IIIB funds for personal cares, homemaker, chore, in addition to your 3E funds?
You know what? That's a good question. I don't know because I don't handle that. Do you, Jess? Jess is on the call too. She's, the other thing that I wanted to mention is we are part of that ILSP funding program, and Jess is heading that up for our agency. So I know that's going to be an option for us, that if they received NSCSP funds this year, that maybe we look at, that program for them so we can get new families into NFCSP. We also do have a waitlist risk assessment tool that we created that once I delete all the personal information out, I can email that to you, Bryn, as well. We're happy to share that. And that basically just kind of help using that point system you were just talking about. We assign points to whether or not they were at risk for institutional placement, minimal caregiver supports, if they were at or below the poverty level, and then using the number of ADLs and IADLs, that assigned a risk number to them. So I'm sure we could, utilize that as well. But again, I'm happy to share that, with the group. And if anybody wants to take it and use it for themselves, please feel free.
That would be a great tool to share, Terry. This is Lynn. In addition, because I think if you are going to have to start waitlisting people, I mean, you could reassess everybody and try to do this if that's what you want to do. But depending on the size of your agency, that may not be possible. But in case anybody ever comes back and questions the decisions that you make, it's great to have a tool like that you can go back to and say, we applied this tool uniformly to everybody. And, and this is the why we made the decisions we did. So
right.
That would be a great thing to have.
And the other thing that's on here that I think is interesting, Lynn, now that you bring that up, is when we hit that, when we knew we had funds that we were able to utilize and to award, because we did this with NFCSP, we did exhaust our funds. And then anyway, I won't go down that road. But when we found when we had additional, where we were given, we realized we had funds to give, we staffed everybody who was on the wait list. And it was a team or two of at least 3, if not 4 of us talking about, where this person was at. So it wasn't just Terry flipping the switch. It wasn't just Jessica flipping the switch. It was, as a group, we decided based on this criteria. So it's got a staffed by and the date that it was staffed. So I think this could be really helpful if we're going to that wait list. So I'm happy to share.
Yeah, thank you.
And the other thing that we have in Brown County is our resource specialist is compiling a spreadsheet of all of the different grant programs that are available either to caregivers or customers. And so they're broken down by the ones that either we manage internally or that are managed by a different agency. So it's like a desk reference for our INA specialists to go to. So if they know that someone has Parkinson's, they can look at that and say, oh, here are specific grants for people with Parkinson's. And we'd be willing to share that too. And she just keeps adding to it as we find more.
And I'm sorry, I think I just saw a message from Jess about the other Jess that we have, Jessica, about I'll get back to you.
Yes, RV says we do not use 3B.
Oh, we do not use
So
3B.
We have
Sorry.
two Jessicas here. Our other Jessica says we do not use 3B funds for personal care, homemaker, and chore.
As far as prioritizing the wait list based on risk, I really appreciate that process. I think it's an equitable way to identify those of greatest need. Is there in that, or could there be in that, a reassessment? So maybe somebody comes to you because there is a risk of institutionalization if these certain needs aren't met. Is there a best practice and a time frame that could be incorporated to reassess? So maybe as an example, if those needs are met, now they aren't at the greatest need, and maybe that changes things so that it's not just a one and done type of assessment process and an award process, but a reevaluation.
Yeah, I agree, because I think there is that when you do your assessment, you have to remember if you take away what they have now, that can change their risk, right? And that's kind of what we've always said about once you get somebody stabilized on one of our programs, then to say, okay, you're not the highest need anymore, and to give it to somebody else, that, takes away their stability that they have. So we do have to be careful about not letting that happen.
Are there any other counties who have a similar type of flow sheet or desk reference, maybe specific to their county or area? If this transportation isn't available, then you go here to see if this pot of money would be able to cover the transportation needs. Or in this case, family caregiver or customer has these needs. We're able to go here, here, and here.
I just have one question about, Jessica, you were talking about that list the resource specialists have. And if they have that list and the INE staff are taking care of that, do they never even reach the caregiver support program then? In that case, they would be referring them out to those other programs, and you might never know that they call, or how does that work exactly? I'm just curious.
Yeah, not necessarily. I think it depends on what they see their direct needs being. If their needs are more caregiver related, then they definitely come this way. Even if they don't qualify for AFCSP or NFCSP, or if we're on wait list, they all still get referred.
The other thing that I'd like to mention is a lot of times our INA people will get someone who doesn't have a caregiver, an identified caregiver. So because they're able to refer out to the Parkinson's grant, or do you know what I'm saying? So there might be a different reason why they don't come to us. But we also
Sure.
did a task force around caregiver support. So anytime, and we'll be rolling that out to our team in the next couple of weeks. So anytime they connect with a caregiver, there is a specific set group of handouts that we provide that caregiver. It's like a caregiver packet. So when you go, you talk about the care receiver, but now this is focused on the caregiver, making sure that they have resources to our caregiver support group, to Trualta, to, the Mug Club email that I send out on a monthly basis. So all those specific AFCSP, NFCSP, all those caregiver supports that are available, they're given to the caregiver specifically with my business card. And then if there is some high stress needs identified, then I'm immediately connected with that caregiver to reach out to them to see what supports can be offered to them. So we are going to be really honing in on that caregiver and making sure that they have the resources available and that I'm connected with them, even if it's just offering them the support groups that we have available.
Right, and I'm just wondering too, the other thing that you said about the independent living supports program, those programs out there that are involved in that pilot, that is going to be a really wonderful opportunity, because even though it's the care recipient who enrolls in it, you can get caregiver supports through it. And the $7,200 available, I mean, that's more than you're giving out in your program now, right? So that's like a huge amount of support that will be available. So really encourage that coordination and making sure that caregiver supports are coming out of that funding too, because we want to make sure that that ARPA funding used for that pilot gets used up and we can show that it's needed. So yeah.
Yeah, Jess and I work in the same office, so there's a lot of banter between us, and we we've already got a wait list. And as families exhaust their AFCSP and NFCSP funds based on what their needs are, they absolutely go right onto that they're in that interest list. So I think we'll have a good handle on that.
Hi, can everyone hear me?
Yes.
This is Denise Roman from Wapaka County. I inherited the program right before COVID, and some of the participants that are on the program have been on the program for 3-4 years before I inherited it. And now, we're going on 7 or 8 years, and it's not a large amount that they're using, but it's that amount that they're using to keep them in their homes, safe, connected, everything. And, when we talk about the waitlist policy and the reassessment and everything, is it okay for someone to be on so long? Is time something that comes into when you're reevaluating someone, because then you might have someone that has a huge need that's going to really benefit from the program, but because you have 1 or 2 of these other people that are just taking a little piece, but they're still on the program for a long time, you just get into this dilemma of, do you help 5 people or do you help one huge person that really needs the help? It's so hard to make those determinations.
That's true. That's true. Is anybody else in that dilemma, and how do you handle it?
I think we struggle with that because I know that we're able to give up to $4,000. And to give $1,000, we kind of drew that line as that's what we were able to offer. And again, we know this barely scratches the surface for a lot of families, but for some, it's all they need. So can I ask, Denise, how much you give each family? Do you work out like a care plan? Do you estimate their anticipated costs? Do you automatically give them the full award when they don't really need the full award? How do you do that?
Yeah, no, we follow the guidelines, of doing the care plan and everything. It's just not an automatic $4,000, but they can use up to $4,000 if that is where their level of need is. And I'll be honest with you, the most of the people that are on it long-term are those Title 3B people, which I understand, Terry, you don't use that money the way that Wapaka County does, but it's just those little, you have a 90-year-old person staying in their home. They've been referred for long-term care. They don't meet the eligibility for long-term care. They're doing well enough in their home, but they just need, the snow plowed or the grass cut. They're already getting home delivered meals. They just need that extra, but they've been on the program forever.
So what would happen if you capped it at $2,000 per family?
Well, Title 3B isn't even, they don't even make that. It's not a huge amount of money that they're expending. I guess it's just that I have several people that are on the program that are long-term, and they're probably only spending, honestly, Terry, probably $1,000 through the year. It's just that little supplemental lawn cutting and
Right.
getting the snow plowed out and those kind of, they do have respite come in not respite, but like a source that comes in to help them with house cleaning and so forth, like once a month. So it's not a huge expenditure. It's just that it's money that is not being taken away from others, but is already, before I even start the year, kind of like, I know that money is expended towards those clients.
But I guess if the purpose of the program is to keep them at home for as long as
Yep,
possible and
yep.
office supports, to me, that's $1,000 well spent. I mean, that's just my logic with it. And when they exhaust that or when they use that $1,000, if they need more, are you offering them more, or are you steering them to like the supplemental grant with our CAW?
I just worked with RCAW yesterday with exhausting my first person that exhausted and sent them that way, because now we're coming to the end of the year and I am getting clients that are exhausting their funding. So yeah, I am working with them to get those. Does anyone know of any funding? I find a lot of my particular clients, it's the Lifeline that, is kind of the thing that is a big expenditure across the board for us. A lot of clients have Lifeline. Do a lot of clients that other counties, do you pay for Lifeline or some type of service for them? Yeah, okay.
And the supplemental grant through our CAW will cover that too.
Great, thank you.
And there too, keeping in mind that they can apply for those supplemental grants every 90 days. For our families, only offering them the $1,000 for them, if they exhaust it in the first 3 months, that allows them being able to apply for that supplemental grant can kind of keep those services in place through the rest of the year. So I think, while I'm comfortable with $1,000, being able to offer those grant programs after they've exhausted our funds has been a huge help, because for a lot of those families, it's the difference between keeping those services in place until we get back to January or not having them at all. So that has really been instrumental in helping us keep these folks at home.
And I imagine for some people, keeping the consistency is really important, because once you lose a provider, it can be hard to get them back or find another one that, yeah. So I think there's something to be said for that too, the consistency and the stability that it gives people in the long run. Yeah.
And something else you might to suggest to your families, especially those who have children, like a lot of our families, what I discuss is when they say, I don't know how we're going to keep these services in place when the money is gone. My first go-to is, what do you typically buy mom or dad for their birthday, for their Christmas presents, for whatever? So why doesn't the family get together and give this as their birthday present? Make sure this bill is covered. And that's worked really well for a lot of the families. It's not anything that they really thought of before. So,
Terry, I've kind of done something similar with being able to offer like $15 an hour for a caregiver, but to make that money stretch out, how about if we do $10 and you match that $10, and then that can make that money stretch out a bit longer.
Well, and I'm glad you brought that up because we cap it at 12 and we share with the families, you are welcome to pay that private person whatever you feel is fair, whether they're providing in-home care or housekeeping or lawn care, whatever the case may be. Pay them whatever you feel is fair. We will reimburse up to $12 an hour. So if you pay them 10, we'll reimburse the 10. If you pay them 15, know that we're going to reimburse up to 12 and that 3 is going to be out of pocket, and that helps it stretch as well. So we do something very similar.
I'm trying really hard to capture in my notes all these wonderful suggestions and ideas. So hopefully we can start to create, I don't know if it's even an FAQ, but just kind of brainstorming and troubleshooting ideas when you're finding or approaching that, you have to turn people away or institute caps that you didn't otherwise have to. I did, when we were talking about consecutive years, Denise, about people being on the programs, I did want to offer, and I'm not saying that we should go down this direction at all. As a matter of fact, I think the point of it's $1,000 well spent if it's keeping somebody out of the institution is exactly the point of the program. Yet I have had experience where there are counties say that they have adapted through the years with their governing board policies regarding the number of years that a family caregiver can be on a program. So once again, if you might be a county in that position, I think a lot of it comes to being proactive and planning with the family. So if we know that they're not going to be on the next year because there needs to be that gap year, if you will, how are we ensuring that those supports are in place? Connecting them with our CAW, connecting them with the Parkinson's. So again, I'm not saying we go down that path, but helping the family to plan for that, I think, is the important piece of that. And I'm sure that the desktop kind of chart that you guys have created in Brown County is incredibly comprehensive. And I also know it's probably always changing, which is a lot of information that I have too, as far as what to bookmark. You find something and you want to keep that, you don't want to lose it. I will add anything that might not be on there, but that will also be a piece too that I will make sure and distribute widely that folks can take a peek at, because I, for one, didn't know there was such a thing as a Parkinson's grant opportunity. So we'll want to make sure we're exploring those.
Yeah, Brian, it should be in your email.
Oh, brilliant. I'm too busy taking notes.
There is one other thing I would like to take an opportunity to mention, just because it's coming up. We've been trying to reach working caregivers more and let them know about our programs. And one of the things the Wisconsin Family and Caregiver Support Alliance is doing is we're going to be presenting in October to SHRM, to the Society of Human Resource Managers. It's their state conference, and doing a 3.5-hour workshop about the kind of help that ADRCs and our programs can provide to working caregivers. Now, we don't know, since we've never done this before, we have no idea what kind of traffic that might create for ADRCs. And I don't know if Cindy Petrowski's on the phone here today or not, but she and I, or at least we're going to be talking on an ADRC Connect meeting in September to just kind of, a heads up, we're doing this presentation. More people, you might get some more calls. It could either be from a company. We're hoping not, because we're giving the companies a lot of information. Hopefully they won't need to call you to get that. But if once they start distributing that, or, talking about it with working caregivers, we're not sure what that's going to mean for our programs, how many calls we'll get. So I just wanted you guys all to be aware of that. And you want to talk to the ADRC, the person who's going to pick up that phone if an employer is calling and saying, we just want brochures about your programs that we can stick in our folders and give to our employees, or I don't know what they might all be calling you for. But just to be aware that we're doing that presentation on October 11th. And so it might generate something, it might not. We don't know what's going to happen, but I just wanted you all to be aware and to have it, you know, and talking to your ADRC to let, because I don't know how often you guys even get calls like that, if an employer would ever call and say, I need something. I'm not aware that that happens very much. But just want to make sure your ADRCs and your programs that you guys are all sort of at least know if somebody calls me, this is how I would handle it. And we can have a discussion about that if you feel that's needed. We're going to kind of give a couple suggestions for the ADRCs. And basically, we don't think the INA people should have a big discussion with them. They should kind of just get them over to you guys and the DCSs, or, you know, whatever kind of caregiver support they're interested in. That's our current thinking. So if you have any thoughts on that, please share that with me as well.
So Lynn, this is Terry. We actually have someone dedicated to work with our employers here in Green Bay. So if I could provide her contact information, we have caregiver presentations. We go out and do lunch and learns. We've got PowerPoints, we've got handouts. And now that we've got a food truck, we're ready and we're prepared. So I'll share Deb's contact information with you. And that would be the direction we would hope Brown County would go to.
Oh, wonderful. So she's there for the whole ADRC or just for caregiver programs?
No, she's here for the entire ADRC, and she works with the employers but we're working with the employers, really trying to bring home the caregivers within their organization. So it's been a 2022 to 4 goal of ours.
Does anybody else have a position like that in their ADRC? Is that common? Yeah, sorry, I only see some of you, not everybody, kind of shaking their heads. If you do, throw something in the chat. Say, yes, we have something like that, because I'd be interested to know. Thank you. And really, if you have any concerns about that, please let me know that too. We don't want to be putting you all in a position where you're going, oh my gosh. We assume there might be up to maybe 100 human services reps from different companies around the state there. How many will land in each of your individual jurisdictions? I don't know if this is kind of a new thing. We're trying to get employers to be our partners. So we don't know where it's going to go, but any feedback, or let us know if they do contact you afterward too. We'd be interested to know that as well.
I did see in the chat, Lisa Wells has shared she presented several times to local SHRM and the regional SHRM conference, and very little interest. And I think we have a bit of a shared experience, and I say we, even though it was before I was in this position. Didn't you, Lynn, and others apply to even present and were turned down a time or two?
Oh yeah,
very little interest.
We've been trying for several years to get them to let us come to the conference. We paid for a booth once, but we did not get a workshop. And this year they offered us a 3.5-hour pre-conference workshop. Like, they really wanted to talk about it. I think it was COVID. I think it's their difficulty attracting and retaining employees. Something in the landscape has shifted, that now they're interested in talking about this and hearing about what other resources are out there that they can add to what they've been doing to try to, pull in and retain their employees. So that's great. They've even been doing a lot of articles themselves about caregiver support in their SHRM organization and publications that they've been doing. So yeah, something has definitely changed. So hopefully we're trying to get some more long-term partnerships with some companies that might be willing to stand up and explain to other companies what they get out of supporting their working caregivers, what benefits they get from doing that. And hopefully we'll see something happen with this. And Lisa, we'd love to have you back in the fold. I know you probably get frustrated when they weren't responding too much, but it seems like this, I don't know if it's new leadership or just the change in the times, but something seems to have changed.
Something that one of our employers had tried doing, sorry, this is Terry in Brown County. I don't know if I should say that, but so something that we tried with one of our employers up here, Nature's Way, we got permission from the Wilder Foundation to use some of their You Call It, We Call It. And so we sent them those files and they put those up in their break room. Like they've got the TV screens, the monitors, and so these were flashing throughout their plant. And that helped their employees, one, connect with the fact that they're a caregiver, and then two, showed Nature's Way how many of their employees really were caregivers. So it was eye-opening to both the employees and the employer. So just something
Things
to
were
think
literally
about.
flashing.
What do you
Like
mean?
they were flashing around? Is that what you're
Well,
saying?
they would rotate. Do you know what I'm saying?
Oh, I
Maybe
see what you mean.
flashing
Okay.
isn't the right word, but do you
Okay,
know what
no,
I'm
that's
saying?
okay.
You
I
know
was
how
just
some
imagining this.
people
My God.
have you know, like marquees or bulletin board or notice boards, but these were electronic bulletin boards, and they would have these You Call It, We Call It, you know,
Oh,
rotating
nice.
through
Yeah.
the TV screens, the monitors, I guess.
Interesting idea.
It's a great idea. It's a great way to identify as a family caregiver first and then ask for help. And I think many employers have a very narrow idea of how many folks are actually being stretched due to family caregiving situations and how
Right.
and potentially they could save them from early retirement or leaving
Right.
if they just could offer or ask what could be offered. Lisa Wells, you asked if you could share about upcoming respite program event. Like, yes, please do.
Yeah, thanks. So myself, I'm the DCS for Eau Claire County. Myself and the DCS in Chippewa and Dunn, Carla Burscheit, and also Susan Susan. We've partnered with the Respite for All Foundation, and in bringing, hopefully going to be able to bring this program to the state of Wisconsin. And so the Respite for All program, what it is, it's a faith-based social and volunteer model that is in churches and faith communities. And so, here in Eau Claire County, we don't have adult day services. We don't have a lot of respite. And so really excited to be bringing this program. It's in 8 other states, and we're hoping to bring it to the state of Wisconsin. And so this event is on September 28th. It's a third Chippewa Falls. Really hoping to get a lot of faith communities, ADRCs, really anybody that's interested in learning about this and how to bring it to your community. And Daphne Johnston, who is the founder of this program, she'll be presenting along with Susan McFadden on how you can bring this to your faith community. And really, it's really awesome. I mean, she has it all, and all you have to do is, take it. There is a cost for churches. I think the training is like $650. But I'm thinking, oh my gosh, in your communities, find a couple of churches to partner together. Again, volunteer driven, social. So anyway, it's coming up September 28th. Please, you can register, go to the ADRC Eau Claire County website, or it's just eauclaireadrcevents.org. If you want to register, I can send the flyer to you, Bryn. If you send it out to everybody, that would be great.
You got it. Absolutely.
Thanks.
And if it's right on the calendar of events, you can even, it's 11 o'clock, but if you want, you can throw it in the chat. Sometimes people who have Teams downloaded will get it in the chat even after the ending of the meeting. Quick question. It sounds like I'll be attending virtually. Oh, there is a caregiver. Oh, Terry. Caregiver roadmap presentation. Any chance anyone else is going? It's in Stevens Point tomorrow. That it would be Wednesday the 23rd. So I'm sorry, I am not. I'm not familiar with it either. If I did, I spaced it entirely. But if you'd like to send me information, I can share that out and include it. Or again, once you can put that in the chat, it still pops up even after we're done. Okay, it is 11 o'clock. I have a lot to do as far as pulling some information together. So keep on the lookout as far as the notes. I will run the link for them in our weekly GWAR newsletter. And when we develop a folder where we're going to house some of the draft waitlist or other kind of point system, assessment system, or risk system as far as when to implement and how to assign points to individuals at greater risk. I will throw all that information into one spot so that you're able to view it and adapt it to meet your needs. So thank you. I appreciate your time. I know you are all busy. I hope you get to enjoy the last bit of summer and have a great day. I appreciate your time.
Thank you. Bye, everyone.
Thank you.